here I am, no experience. I have this research assistant position. I was so happy. I read the protocol. I was trained in what I was supposed to do. So I came in like, oh, wow, I have this tool bag of like helpful information. I'm this hero, going into the community and saying, I have this information you don't know. Let me teach you so you can take care of your children. That's my attitude. I'm like 21, just young going in. And I quickly learned that they know more than me about asthma, and having conversations with people when they're saying it's not me, it's because our housing community is across from a mountain of coal dust that blows throughout the air. So, how can we manage our child's asthma triggers if we can't control the environmental triggers that we live, in every day?
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 27. Hi, everyone. My name is Amari Richards. Thank you so much for joining me here today. Definitely subscribe if you have not subscribed as yet. Leave a like if you're on YouTube. Review this if you're on any podcasting platform. I greatly appreciate it, and it helps me get the show out to more people who need this information. So I appreciate it there. I hope that everyone is doing well and doing fine, staying safe, staying hydrated, and whatnot. Um, this episode is a really good one. But before we get into that, I just wanted to say that I'm going to be opening up some public health happy hour talks. It'll probably be December and then every Tuesday in December. But I'll probably have a calendar out for that sometime soon. So look out for that. But 7 p.m. on Tuesdays in December, public health happy hour chats. And without further ado, here's today's episode. Today, we have a public health professional with 14 years of national research experience. She did her bachelor's in sociology from Fort Hays State University. Then she went on to complete and graduate from Eastern Virginia Medical School with a master's of public health degree, working in various roles such as research coordinator, grant and research manager, program manager, as well as having her own consulting company, publichealthresearchingconsulting.com. She also has an Instagram at Public Health Culture. We have Leonore Okwara,
Mhm.
MPH. Welcome to the show.
Thank you. Good job saying my name. I always want to see how people say it, and whatever comes out, that's what I answer to. Like, okay, close enough.
How do you say your name?
Leonore Okwara. So you
Okay.
said it right. Good
Okay,
job.
awesome. Because usually I ask people before the show how to
Yes,
say
you
the
did
last name,
it.
but I'm glad I got it correctly.
You did. You did.
So, how are you doing today and coping during these times?
I'm doing okay. Coping, that is a really loaded question. How much time do we have, Omari? So yeah, coping during this pandemic especially has been very difficult. I'm working from home full time. I have 3 kids, so 2 of them are in virtual school. One it has not quite reached school age yet. So really trying to find the balance has been difficult. My husband's in the military, so his schedule is all over the place. So I really had to take a deep breath and say, I need a break, like really listen to my mental and emotional status and just say, I really need a break. So I took a week off of work last week, and it was the best thing I could have done. I don't know why I didn't do it sooner. And so I just encourage people, if you have time to take off, to go ahead and do it. But when I think about my situation compared to our frontline workers, there's no comparison. You know what I mean?
Mhm.
We have our medical workers out there, we have community health workers out there, grocery store staff, we have janitors, so I just tip my hat and just say thank you to all of the frontline workers who are out there working so hard to keep us healthy.
Yeah,
So, Yeah.
Yeah, definitely. And I think today is like Public Health Thank You Day,
Thank
or
you.
I
Thank you.
I never heard of that day before
I
until
never did either. Exactly.
today.
Today was my first time hearing of it too, but thank
Yeah.
you,
Yeah.
to everyone out there.
Yeah, absolutely. So thank you for sharing that. And I know you
Yeah.
touched on a little bit of your personal background there. So how
Yes.
do you identify?
Identify she, her. I am a Black woman raised by Southern parents, in San Diego. So you could tell all of the cross cultural, the background I grew up with. It has been major in contributing to my experience and contributing to my outlook in life. But yeah, I'm a mother of three. I'm a wife of, my husband, who's in the Coast Guard. So he's been in the military for 16 years. So that really contributed a lot to my decisions in terms of my career, and what I decided to go into, academically.
Okay, awesome. Um, Before I ask you what public health means to you, what does your t-shirt say?
Oh, my t-shirt, it says
Yeah.
busy
Yes.
reducing my risk factors.
Okay.
Yes, it probably is showing up backwards.
No,
Oh, it's not? Okay,
it's
good.
not.
Because I see it backwards. So I'm like, oh, why did I wear this? And you can't read it. But no,
Mhm.
it says busy reducing my risk factors. I bought it from an Etsy shop. It's Jane L shop. She's a breast cancer survivor. She was diagnosed with breast cancer at 26. And she's a teacher. She's local here in Maryland, and she has her own Etsy shop. And I had an opportunity to meet her, and she was wearing this. And I said, oh, this is amazing. It just represents everything that I want to do, in public
Mhm.
health. So,
Yeah, that is awesome. So I guess going
yeah.
along that same track, what does public health mean to you?
Yeah, I love this question. And I think you get different answers, just based on everyone's experience. For me, being community focused this whole time in terms of community based research, public health means trust to me. It means building relationships and partnerships, not only with the community, but with your colleagues. Public health to me is sustainability. So it's going in, creating those trustworthy relationships, partnering with the community for long time success. So public health, really encompasses the future for me and sustainability. And so that's what I would say it means to me.
Yeah, thank you for sharing that. So you started off doing your bachelor's in sociology from Fort Hays State University. What was your thought process for going into that degree?
Oh my goodness. So I was one of those kids in high school. I had no clue what I wanted to do. And my sister was an English major. I'm not a writer like that. And so I decided to go into English because she did.
Mhm.
And so quickly I said, this isn't for me. I'm more of like the sciences type of, person. So I went into bachelor's in biology. I decided to change my major to biology. Um, and it was great until I had to take physics. So I did well in the lab, the lecture, not so much. And I said, okay, this may not be for me. Let me really think about what I enjoy doing. And it was the community aspect. It was looking at the influence of society on people and, neighborhoods. And I decided that sociology was the best major for me. And plus, I wanted to graduate too. And so it just really was the best of both worlds, with me choosing sociology because something clicked when I started taking classes in that degree. So, yeah, it was a roundabout way, but I'm happy with the way things ended up.
Okay. Yeah, I'm glad to hear that.
Yeah.
Are there any experiences that you would like to speak about during that time, or not so much?
Um, I think the biggest thing was, for me, I didn't have enough experience with different career fields.
Hmm.
So, what I wish I would have done It's just in college, get as much volunteer experience as I can in just any subject I thought I was remotely interested in. And that's something that I plan on doing with my children. So, in high school, I want them to volunteer everywhere just so they can see, even if it's just, I don't want to do any of these things, at least they know. So
Mhm.
I really do wish I would have done more volunteering and speaking to people. And of course, when I graduated, people and professionals weren't as accessible as they are now. So
Mhm.
I really think people who are going to school now have that added benefit of being able to reach out to and connect to professionals directly. So yeah, that's definitely something I wish I would have done more of.
Yeah, and it
Mhm.
definitely is a lot easier now with LinkedIn and social media
Yes,
around, where you can just easily look for people in your region, look for organizations, and really just connect with people that way.
exactly. Yes.
Yeah. So I know you went on to do your Masters of Public Health at Eastern Virginia Medical School. Did you have any public health roles before then, or not so much?
No, I didn't. So again, my husband was in the military. We just moved, well, we moved from San Diego to New York for a year, and then he was stationed in Virginia. And so I had finished my bachelor's, and I was thinking about, like, I knew I wanted to go to grad school, but when I thought about getting a master's in sociology, I said, what could I do with that master's? That's sort of like a role you have to go into a doctorate program for. And
Mhm.
at that point, I wasn't thinking that far ahead. So I decided to still apply for a master's in sociology program. I applied for a community health master's program, and I applied for a public health master's program. So I was accepted into all three programs. And then I had to think about um, sort of like what I could use, what role is more versatile.
Mhm.
Because my husband's in the military, we would be moving around. So, what would be easiest for me to get a job in? So, I really started doing my research about what career fields were available with each degree. And public health was just like, yeah, you can pretty much do a lot of things with a public health degree. And so I said, oh, okay, this would be good for me to look into. And so it was through the medical school. I thought that would be good because getting a degree from a medical school and having access to the professionals that I had access to really was a great decision for me. So that's how I came out with choosing that program. I was really limited though. Like I said, my husband's in the military, so I could only go so far.
Mhm.
So I applied to what was local.
Okay, fair
Mhm.
enough. And what was your concentration in your MPH program?
Yeah, so my MPH program only had two tracks. It was health management
Mhm.
and it was epidemiology. So again, I thought about what would be transferable for me traveling around the country, and epidemiology seemed like a good fit. I was good at math and statistics, and I decided to go with that. I'm not really using those skills now. But when choosing between the two, that's the direction I chose. So
And do you think not choosing the other has hindered you, or do you think it wouldn't have mattered that much?
I don't think it would have mattered, especially for me, just being in the research field. It
Hmm.
it really wasn't a factor at all. Just me having my public health degree. I think I could have had a general degree, and it would have been fine.
Okay. So during your time in your MPH at Eastern Virginia Medical School, you were a research assistant for the Eastern Virginia Medical School.
Uh
So
huh.
how did you get this role, and then what did you do in it?
So I had already applied to the program,
Hmm.
and I needed a job. And so I was applying all over. I really didn't know. I knew I wanted to do something that was community based. But really at that time, not having any experience, I just wanted something, just to get my foot in the door. So I applied for a research assistant position. And what I was primarily responsible for was recruiting
Hmm.
in the community for a research study. It was an asthma grant. We recruited in public housing communities in Virginia. We were working with kids who had asthma. and we were educating their parents on how to reduce indoor and outdoor environmental triggers so they wouldn't have asthma attacks. Because based on our needs assessment and our literature review, we saw that they were spending a lot of money, well, the hospitals, on treating children with asthma in the emergency rooms. So in that area. So that's what that grant was for, to sort of educate the parents so that they can help their children maintain and manage their asthma so they don't go to the ER. So I was responsible for literally going door to door and talking about research, to a community that doesn't trust research, and justifiably so. Um, and it was interesting, and I'm going on a tangent here. So stop me if I go
You
too
go
far,
ahead.
because I will
Go
talk
ahead.
about this. So I went in because here I am, no experience. I have this research assistant position. I was so happy. I read the protocol. I was trained in what I was supposed to do. So I came in like, oh, wow, I have this tool bag of like helpful information. I'm this hero, going into the community and saying, I have this information you don't know. Let me teach you so you can take care of your children. That's my attitude. I'm like 21, just young going in. And I quickly learned that they know more than me about asthma, and having conversations with people when they're saying it's not me, it's because our housing community is across from a mountain of coal dust that blows throughout the air. So, how can we manage our child's asthma triggers if we can't control the environmental triggers that we live, in every day? You would see the dust collecting in the windows because we would take dust samples. We would collect dust in their inside, and we would see the coal in there, and it really was like a light bulb moment for me that I can't come in and save the day. I'm not a hero. If anything, they know more than what we know as so-called professionals. Yes, we do the needs assessment. We look at the literature. We, look at all this data, and that's great. But it means nothing if you don't get the opinion of the people it's impacting directly. You know what I mean? So that was just like, oh, wow. Oh my gosh. I love this. Like, and so it just became such a rich opportunity for me to talk to people, for me to talk to them about research, and to address some of their fears about research. And I knew I had made it in the community when they started calling me the asthma lady. Like I would walk around and you have people hanging out outside like, hey, asthma lady. And I said, okay, okay, this is cool. So yeah, that was just, it was such an amazing experience. And it's something that I never want to forget. And I haven't forgotten since I've been working in the field. That was my introduction to public health, and what really sealed the deal for me. That community engagement was my passion.
Yeah, well, thank you for going on that tangent. I,
Yeah,
I think we
yeah,
definitely appreciate that. And yeah, public health is like for community, with community, by community, and we definitely
exactly.
have to keep the community at the forefront whenever we're thinking on and doing everything in public health. So,
Yeah.
what would you say you learned about like trying to rebuild that trust for the people to come and do the research, or just like any mistrust that you saw there? How did you work to rebuild that?
So the big thing was changing my attitude about it, really taking a step back and thinking of them as the expert in the field. I am the expert in the research process. So, putting together a consent form or talking to the institutional review board, I know all about that. So I need to stay in my lane. And then when I'm talking to them, it's really like I'm in a place of learning. I'm asking them questions. And I think the other thing was with the change in my attitude is not thinking that just because I'm Black going into a Black community, I'm a shoe in. They're automatically going to trust me. It'll get my toe in the door, but that's it. So, really, what was big with what I did was transparency. We have a consent form that we review with them, but how many people take time to go through it and check with them? Do you understand what I'm saying? Do you get it? Repeat it back to me so we can make sure we're on the same page. Do you know that at any time you can quit? Do you know if you have any questions about what's going on, you reach out to me? Do you know that we will give you a lay report? Because this is what's been big with researchers is they go into a community, they collect the data, they leave. And the community's like, oh, I gave you all my information. What happened? So really making them a part of the process and being transparent with them and explaining things to them so that they really get it and they're explaining things to me so I really get it. It's really a true partnership. And so I learned all of those skills just in that one position. And it was so valuable.
Yeah, and I think
Transparency is key.
yeah, and I think that just speaks to having like the relationship and having the authentic relationship to really build and trust one another to do that type of
Yeah,
work because it is like some intimate kind of stuff.
it is. Yeah. And they want to see that you're there. You're not all talk. So a lot of it was showing up. They would have events at the Boys and Girls Club, and we would just show up. They would ask us to bring something or ask us to attend something else, and we would show up even if they didn't. The fact that we were there, keeping our word. So it really is a lot of effort on the part of the researcher to let them know we genuinely care about you. Even
Mhm.
outside of the research, we are here.
Yeah, absolutely, absolutely. So jumping along to your next role as research coordinator for the Eastern Virginia Medical School. So was this a promotion into this role, or did you like get this role after you graduated from your MPH, or how did that work out?
Yeah, this was a promotion. So I was fortunate to work at the medical school while going there. So it was just, oh, it was such a blessing. Um, and so in my first year of the program, I worked as a research assistant. And then one of the second years left that research coordinator position. And so I just slid in and talked to the supervisor or the principal investigator of the grant, and I interviewed and I got the position. And it was also interesting. So in my research assistant position, I worked, really out in the community recruiting. And then for my coordinator position, we did a lot of like data analysis. We did a lot of interviewing. So I wasn't out in the community recruiting, but I learned a lot about qualitative analysis and data entry with surveys and conducting analysis. So it really was it was different skills, but skills that I would need for the future.
Okay. Yeah, that definitely sounds like it was a beneficial role and you built into it.
Yeah.
Um, um, I don't know what I was gonna ask, but anyway, so you had a next role as a research health science specialist, program manager at the U.S. Department of Veteran Affairs, or USVA.
Yes.
So how did you land this role, or what was the thought process between switching roles to get this role?
Right. So, as I said, the research coordinator position really helped a lot.
Hmm.
I learned different roles that I didn't learn in my research assistant position. And that's part of the role as a coordinator. You take one research study and you're responsible for what happens and making sure it runs effectively and tracking it properly. And so it was time for us to move, and my husband received orders to California. So I said, I need to find a job. And I applied to several positions, a couple of them being a program manager position, which when I read about it, I didn't think I was qualified for it because essentially it's a research lab. So it's multiple studies that you're responsible for. And at that point, I coordinated maybe two studies at one time.
Hmm.
So I really didn't think I had the skill set. But my cover letter and my resume, um, I really made sure I played up my experience with the community and just handling just multiple tasks. And so I know you had posted when you got your position, your information. And I was like, yes, this is great, like to share how you landed the role. And
Mhm.
so for me, that was my biggest thing. I really looked at myself like, oh, I don't know if I qualify. But then writing everything down, I said, oh, I can do this. And
Mhm.
so I interviewed. At that time, we weren't in California. So I interviewed virtually and landed the position as a program manager at the VA. So that was a huge role for me, especially, and one that would really solidify my love for doing this work.
Yeah, and I think that definitely kind of talks to imposter syndrome
Oh
and
yes,
looking at those applications, especially when you're applying to like a bunch of different places, and you look at the one that says, "Oh, 5 years of experience, and you need to be like a supervisor and all these kind of different
exactly.
things." You're like, I don't know if I should do this. But then when you actually start getting it all out on paper and getting it down, you do see that you do have a lot of the skills that are necessary for the role. And
That is the truth.
yeah,
That is so true.
so you definitely just have to sometimes, I guess, take that risk and put it out there to try to get those opportunities that you personally might not think you're ready for, but you definitely are at that point in time.
Yes, exactly. Get over your fear. If anyone is out there, just do it. And since then, I've been just, oh, I'm going to apply, so it's been working out.
Yeah, because the worst that they could do is say no, or just like
Or
just never,
nothing.
yeah,
Exactly.
just ghost you, you know.
Yeah,
Yeah. So
exactly.
you said this role is like it was a very big role for you. So how so, and how what did you do in this role?
Yeah. So this is the first role I was managing millions of dollars in grant funding. I went from managing, a $20,000 grant to managing millions. And with that role, that required me to come up with different strategies to help myself run things effectively. Because think about it, each time I moved, sometimes I would move on a team where they are midway through a study.
Hmm.
And I had to learn the protocol fairly quickly to be able to execute it seamlessly. Because if I go in the community and they see me, really not understanding what I'm doing, that is going to be a trigger for them and they won't want to participate because they'll say, you don't know what you're doing. I don't trust you enough to
Hmm.
give you my information or to continue in
Hmm.
this study. You know what I mean? So I
Yeah.
really had to figure out a way I could go in and review the protocol and understand it. So this is the role that helped me do that because I didn't have those skills of managing multiple large studies. I really had to sit down and figure out the best way for me to manage things. So how do I take that grant budget and turn it into something that I can track that makes sense? Because of course there was someone else in my position and she showed me what she did, which was helpful, but that didn't help me out. And so also that was the first time I managed someone
Hmm.
beyond volunteers. So that was an experience within itself. Also, I dealt with contracting, with data use agreements. I dealt with grant writing, which I had done a little bit in my role at Eastern Virginia Medical School.
Hmm.
But this was like the first time I was a part of a grant writing team writing grants to NIH, for millions. And
Hmm.
so, really being a part of a grant writing team and seeing all the moving parts and being responsible for getting those letters of support from community organizations. I also handled all the problems that came up. So, if there were problems in the lab with the air conditioning, it went to me. I had to figure it out. If we were posting positions, I worked with HR. I met with the budget team monthly about the budget and where we were while also internally tracking the budget. I
Mhm.
also was involved with recruiting with the institutional review board, putting those IRB applications together. And that was, locally in California, but also nationally.
Mhm.
So then I learned how to navigate that whole multi site research and the complications and the red tape behind each research team IRB, like it
Mhm.
was just, I learned so much in that position that now, whatever I did after that was just simple because I really was able to figure out strategies to keep myself afloat.
Yeah. Oh wow.
Yeah,
That definitely is a lot, and I'm glad that you were able to step up to the plate and really take advantage of that and learn those processes to be the best in that role. So if you wouldn't mind, what are some of those processes and things that you have did? Because you said that the lady before you showed you how she did some of her things, but you didn't really resonate with, I guess,
I
all of it, or
didn't.
you took some of it. So tell us a little bit about that
Exactly.
process.
Yeah, the biggest thing for me was creating a manual. And it may seem simple, but creating a manual for me of things that I was learning about each research study helped me not only be able to update as things changed, but when I started hiring people, it served as a training tool because I had everything written down so I could just go through the list. So creating that manual for me was helpful. The other big thing for me were trackers, having an enrollment tracker, a recruitment tracker. And it seems like a lot of data entry, like tedious data entry, which it is. But when it comes to reporting to the funder, or if a community participant has questions about an incentive they received, or if you go to write a lay report or a report for the funder or IRB, you have all your data there, or a publication. You'll know, okay, on this day, we approached 20 people. Of those 20 people, five said yes. Of those five, two actually followed through with everything. So you have everything written down and it just makes future tasks easier. So having trackers are was my saving grace
Mhm.
because when you manage multiple things, you can't remember all of those simple tiny tasks that or activities that happen. So I wanted to create something where I could not only go in and remember what happened, but also any of my team members, in case there was an audit, and I wasn't there, they would be able to go in and say, oh yeah, here's the enrollment log. This is who's enrolled. This is who dropped out. Everybody would be on the same page with everything.
Okay. And yeah, and I think just thinking about it in that way, like if I was to leave for a week of vacation, would somebody be able to pick up and just take off where I left behind? And when once you're able to say yes, then I think you have things set in place.
Yeah, but that's after, trial and error. When things happen, you learn from it. You're like, okay, next time. Because I'm telling you, that audit, that first one, I was like, what? I didn't know research studies were audited. So yeah, that definitely helped me prepare for the future with that
Yeah.
first audit.
Yeah, I could imagine. And audits are definitely not fun experiences, but
Yeah.
but I guess you got that under your belt now too.
Yes.
Awesome. So after this role, you moved on to a grants and research manager at LSU Health Sciences Center in New Orleans. So how did you come
Yes.
across this role?
Yeah. So once again, we received orders from California to New Orleans.
Hmm.
And I ended up working a year from home for the VA. We were stationed in New Orleans for 2 years. So the first year I was working from home still for the
Okay,
VA.
okay, so
And
before we talk about that, talk about how was that switch from working in person to virtual for that year?
I know, and it's so funny, and now we're doing it,
Hmm.
it was hard for me, and which was the reason why I decided to apply for local positions,
Hmm.
because I spent all my time at home, and I know people, understand that now, but then it was really hard for me being that person who likes to be in the community, and I really feel like I'm an introvert. at heart. But the community engagement part just brings something different out of me. I really enjoy it. And so I missed it.
Hmm.
And then I just made the decision to apply for different positions and ended up getting this one with LSU.
Okay, and that talks to like you don't know what you miss until like it's gone
Exactly.
sometimes, right? Yeah,
Exactly.
but at least I guess you found out and you knew that you love that community engagement part, and that is like part of what really gets you happy about this and excited about this type of work.
Exactly. Yes. So in my positions, they weren't focused on one particular topic area. Like, and I think that when I'm asked that, like, oh, what public health topic are you most passionate about or area, I don't really have like, a health topic, so to speak, because I worked on research studies with asthma, autism, child abuse, PTSD,
Hmm.
chronic pain, caregiving, tobacco. Like, it's not really a health topic that I'm interested in. It's more of the community engagement and research aspect that I like. So, with this position, with the grants manager position, it was a clinical program. It was a tobacco cessation program, and they wanted to build a research team. And so they hired me for that. And that was so interesting to me. One of the studies we worked on was recruiting pregnant women um, to be involved in a tobacco cessation intervention. And this was when I really knew it sort of set the stage for my consulting business. But again, I had to go in and learn the protocol. They were at the beginning of the study, the grant was approved, but I really didn't know what was happening. So I had a whiteboard in my office and I said, I'm going to take the protocol and like break it apart. So we have like the pre implementation, we have the implementation phase and post implementation. And I'm just going to write down all of the activities that I see in this protocol. And so I did it with the PI. And he was like, "This is great. Like, is this what you always do?" And I said, "Well, no, this is just what I need to do now to understand what's going on and, where I need to intervene." And then I did that same thing again with another PI I was working for. And then I did it with two doctoral students. And it all like worked out, just mapping out the protocol for them and really looking at the problems that they could encounter before they go in the community. So when I initially did this for the tobacco study with pregnant women, we realized the team didn't go in and talk to the right people just yet. They talked to half of the people they need to talk to, but they didn't talk to the clinic leads. And so, luckily, we were able to do this before we actually went in trying to do the work. But that was all because we sat there and we talked about it and we mapped everything out. So, that really was nice for me to really solidify my method, but then also be a part of a team who was building, a research component. So I really enjoyed that position. And then we moved again.
Okay, and so you moved again, and that next role as a program manager at University of Maryland. So before you jump into that role, what sites do you use to search for jobs, or how did you use to search for jobs? What was your preferred method?
So it was a little bit of everything. It was referrals from people. Um, a lot of the friends and colleagues I met in whatever city I was in, they would always, for some reason, know someone in the next place I was going. So I reached out to those contacts. I also looked on Indeed a lot. I think that was my primary source. The other thing I did, because I knew I wanted to do research, I would just contact research organizations directly, whether it was, the department or HR. I would contact them about any available positions.
Okay, awesome. Thank you for
Mhm.
sharing that.
Yeah.
Oh, and I didn't want people to miss this either. Earlier you said that you really found out that you found that your love in like the the community engagement parts and not so much a public health topic. And I think a lot of times a lot of people just think about the public health topic, and I think we get too bogged down in that too much sometimes. So I like that your perspective wasn't so much on what topic am I doing, but how can I engage the community in whatever that topic is to best engage them, you know?
Yeah. Oh, you said that so perfectly. I love the way you said that. Yeah. And it's interesting because people try to make me choose, like,
Hmm.
no, you need to come up with something. And I'm just like, I can't, like, I don't know what it is. And so I was really trying to force myself, but it didn't fit.
Yeah, yeah, fair enough. Okay, so now back to your program manager role at the University of Maryland. So you applied to this role, and so what was the switch in this role? What did you do?
Yeah, so this role deals with cancer education. And what attracted me to this role was that it was public health, it was a community based participatory research lab, program manager position, but also they did work in the Black church. And so I said, wow, this is interesting. Like, I've never done community based research in the church. And this position has been amazing for me in terms of really understanding um, how to leverage trusted community figures as community partners in research. So, a lot of times before in the research studies that I've been managing, it's been us going into the community, building relationships, which should always be done. Like, no matter what, you as a researcher should always make it a point to connect with the community that you are serving. But this was the first role where I saw how powerful those community partnerships were with trusted figures. So these are people who are well respected in the community, and they are not going to ruin that respect just to be a part of the research study, so they have to have some trust with the researchers as well. And so it speaks a lot for our community partners who are working with us and really believe in the work that we do, because they have trusted us with their community as well. So that's really big for me. And this position, I have really seen the power of making the community a partner and not just taking on that I'm a researcher, I'm the savior role.
Hmm.
Because I've seen our community members, they're now published authors. They speak at conferences, so they are getting that research experience as well. So then, when the study's over, they can now go into the community and lead their own work. So I've just learned so much more about community engagement, and it has been amazing.
Yeah, and I think that that's so important that we definitely have to continue to try to work to build the capacity of those communities, especially the ones that have been underserved, marginalized,
Yeah,
ill-used for research in the past, you know.
exactly.
So that's a great
Yeah.
point.
And I think that that's the big thing too. Like, a lot of who we or many people who we work with, they don't have health conversations. They, keep it to themselves. I mean, typically that's what happens in the Black community. So to be a part of a study where you see, or a lab where you see an increase in conversations, and people at church are just having conversations about being screened, it's like, okay, wow, this is it. As long as there is trust there, and they respect you and you respect them and you show up, it's going to work.
Okay. Yeah. So I guess with that being said, you've had many different roles in many different places around the
Different roles.
country. So
Yes.
with 14 years of national research experience, what are your big takeaways from the work that you've been doing?
Oh my goodness. My big takeaway is trust. Without trust, none of what I do will work. What's the point of research if you don't have, willing participants who believe in the work and who really think that you have their best heart in mind? Um, so that was my biggest takeaway. The other was flexibility. You can't, be a military spouse and not be flexible. I mean, you can be, but it'll make it hard. So I really learned that early on. And I think that helped with the research. It's unpredictable. You never know what you're going to get. Yes, we write grants that you list out, you know exactly what you're going to do. But when you add the community component in there, all that goes out the window, it
Mhm.
just goes out the window. So, really being flexible and just moving with the flow or going with the flow has been my biggest takeaway. And once I learned to just relax, that really helped me out and really helped me enjoy um, that unpredictability.
Okay, awesome. Thank you for sharing that.
Hmm.
So after that program manager role, you pivoted and you started your own consulting company, public health research consulting. So what was the thought process, I guess, before starting this, first starting it?
Yeah. So when I worked at LSU and I was talking about like that mapping method I came up with, and how I tried it on other people with their research and it worked for them and made things clear. Um, I said, oh, I think I have something here. And I started looking at like program management trainings that were available. There weren't many out there. I started looking at certifications for program managers, and they have like clinical research, professional trainings. They have the PMP, but I was really looking for that community based program manager. Just, I don't know, just information, and it really wasn't out there. And so I decided to offer that as a service to newly funded investigators, because those that are more experienced already know, how to run their studies, they know how to document them and track things because they have all those years of experience under their belt. But I was finding with the new investigators I worked with that they didn't know that. They were excited to get a grant and then they were thinking, oh my gosh, now I have to do the work. Like, where do I start? And so they have mentors that help them with the science part of it. But as far as the administrative part, they don't have the money to hire research assistants to do this work for them. And so I know that they do it on their own because I've been around and I've heard their pleas and their cries. And so I offer that to them. I teach them that as well. But also, because I am a research support staff, I also offer trainings for research assistants, coordinators, program managers, and sort of like a program management boot camp for them, where I share what I wish I would have known when I first started managing research studies. So, yeah, the pivot took place. It was out of a need um, for this type of training for people.
Okay, that's awesome. Um, well, I have a question at the importance of community-based research, but I feel like you've touched on that throughout the
Yes.
entire podcast. But if there's anything else you want to talk about around community-based research, please feel free to.
I think the biggest thing is showing the community that you are genuine and that you really care about them. And I say this because as researchers, we have deadlines we have to meet with funders and IRB and all this stuff. But if something important or something major happens, like everything that happened with the Black community this year, check on them, make sure they're okay. Or if you're working with another community that has experienced some sort of traumatic event, who cares about the survey information you're trying to get or that intervention visit you're trying to do? Check on them and be genuine about it. Let them know this isn't about the research. I'm checking in on you. And also, after the research is over, please continue to show up in the community. I've heard so many times throughout my career when I go and I begin to work with the community that, oh, this other university came in and you guys better be happy we're letting you in. But if this doesn't work out, that's it. We're not letting any other researchers in. There have been so many times I've heard that. And so there's like this pressure on me to make sure that they know it's about you. We really want there to be this sustainable change. You talked about building capacity, and that's what we want. We want to be able to leave and you use all the resources you already have. It's not really about filling that gap. It's really highlighting what resources the community already has in place and really letting them know and showing them you have the capacity to do this without us.
Mhm.
So I really just feel like building those relationships are important for researchers. And all the researchers out there, if you are nervous about building those relationships, find community partners, talk to them, build relationships with them, and see if they will help bridge that gap between you and the community.
Yeah, that was very beautifully said.
Thank
Um,
you.
you're welcome. So, what was the process for you developing the programs that you work around in your consulting business?
So a lot of it was based on like trial and error. You put it out there and there's no bites, and you're like, okay, that didn't work. And then you put something out there and then there's this huge response. You're like, okay, this is great. So I do a lot of like polling my audience to see what they like. When I do webinars, I do a lot of evaluations to see what they like and what they thought of it. And that really helps drive the need. For some, especially with program management, it's sort of hard to pitch as like something that they need.
Mhm.
Um, but for that, I know that it's a need among newly funded researchers because that has been my experience all of these years talking to them. So, really, for that, it's me showing them, like, I know your pain and I have a solution for that. So, in that respect, that's sort of like me convincing them that this is what they need. But with the other things I provide, like other trainings, I really listen to my community and what they're interested in. Um, I had a research and communities of color summit um, in October, and it was really about increasing community engagement in research,
Mhm.
really among the Black community. For next year in August, I'm going to host another one and I'm opening it up. I would love for researchers, who are Indigenous people, Asian, Latinx, Pacific Islander, Native Hawaiian, and Black to come and talk about community engagement and research and give strategies, on how to engage the community in research. But the one I hosted in October was great. The first day I talked about community engagement. Second day talked about the research process. Third day talked about sustainability. And based on the evaluations, so many people love the community engagement part. So that's just an example of how I take those evaluations. And then for next year, I'm focusing on community engagement. So
Okay, awesome. You said next year, August next year.
August next year. Yeah.
Awesome, awesome. That's
Yes.
great to know. So you also have an Instagram platform, Public Health Culture, or at Public Health Culture, I should say. So what made you want to start this?
Yeah, so this I started, I don't even remember now, probably 2019. Yeah, February 2019, I started Public Health Culture. And it started out as public health consultant and then changed to public health culture. And that happened a lot with me. It's just like trying to figure things out, trying to figure out what sticks. And the inspiration behind that podcast was really, it really started out as professional development for me. I went to APHA conference and, I was in a tunnel with my research, and that's all I was focused on. So going to APHA really helped me see like, oh, other people are doing all these amazing things. And so I really wanted to continue learning about what others were doing. So, pretty much for the first year of my podcast, it was just me, like researching different topics and just talking about what I learned. And then January of this year, I started bringing on others because I said, this is a lot, for me to learn. I would just love to talk to people who are leading public health initiatives or leading public health research or just involved in anything related to public health. And I want to hear from them and what they do. So that's really what prompted the podcast is professional development and wanting to learn more about what other people were doing.
Okay, awesome. And what have you learned along the journey of creating that podcast and the platform around it?
That public health is vast. It is everything. It's everything. There are so many different facets of public health. And when people say, I don't have experience, I only have math, experience in math, or I only have experience, I'm like, that's public health. Like everything is public health. And so the variety of professionals I've interviewed have just confirmed that for me, and just to hear everything going on and the impact that everyone is making collectively is such a beautiful thing.
Okay, yeah, that's awesome. Um, well, definitely go and check out that podcast, everyone.
Yeah.
So
Hopefully I have Amari on.
yeah, that'd be great. So I wouldn't mind whatsoever.
Yeah,
Definitely just keep these conversations going. I feel like
absolutely.
that's one thing I've found just to be very important in this public health. We'll just need to have those conversations open.
Yes.
Yeah. So where would you like to see yourself in the future?
I would like to see my public health research consulting business booming. Me talking to and traveling to different organizations, doing major trainings for new researchers so they can get started on the right foot and really build that community trust as well as the funders' trust.
Mhm.
So I would love to just travel around doing trainings for departments, including newly funded researchers as well as their support staff.
Okay, awesome. All right, well, thank you so much.
Yeah.
Is there anything else you'd like to share before we move on to the Furious Five?
No, that's it. I think I've talked a lot.
I think you talked.
Sorry.
No, you talked just enough. Don't you worry
Okay.
about it. Okay, so moving you along to the Furious Five, which is the last section of the show, and the five questions I ask all guests. Although I ask most guests the same sorts of questions,
I
but
understand. Yeah.
but anyway, number one, what advice would you give to a student trying to pursue a career in public health?
Oh, I love this question. It would be to learn about grant writing. That was, I mean, the best skill I could have learned. It helped me also before I started public health research consulting. I worked with nonprofits, like as part of my consulting business before, to write grants for them. And that was the way I made money. I learned so much about the research process and managing budgets. And I think learning how to write grants is the best skill that you can have in public health. The way to do it, because when I learned directly from a principal investigator, but now there are so many groups on Facebook, LinkedIn. There are so many free trainings that are out there that it's easy to learn. And if you want to practice, there's so many nonprofits who need grant writers to volunteer for them. So you will be able to perfect that skill very easily.
Yeah, and that is absolutely true. A lot of our nonprofits need grant writers and needs
Yes.
like students who can help them write grants. So
Yes.
definitely reach out and ask about those opportunities.
They will say yes.
Hmm. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
Oh, the biggest thing is the community engagement part. The research part, easy to learn. The community engagement part, if you don't have a heart for everything that comes with engaging the community, because it's not easy, it's
Hmm.
not all roses. It takes effort. It takes time to build trust. Sometimes you can do it in 6 months, sometimes it takes 2 years. But are you going to be dedicated? Are you going to be committed to working with that community and to show them that you are genuine. So really the biggest part is that community engagement part and the relationship and the rapport building you do with the community.
Yeah, awesome. Number three, what's something you're working on improving in your life right now?
Oh, the big thing, delegating. Oh, that's so hard for me. It is so hard, and it is necessary. Um, because I think about when I was a research assistant and coordinator and how I would not have learned what I learned had people not delegated their tasks to me. And so when I think about it from that perspective, I don't want to hinder anyone from learning skills that will be, crucial for their development in the future. So that is definitely something I'm working on.
Yeah, I like that one. And like I never thought of it from that perspective, but yeah,
Yeah.
yeah,
Mhm.
awesome. Number four, professionally, do you recommend anything
Professionally, so I have a
besides
book.
your summit next year?
Oh yeah, besides my summit, I have this book. It's Medical Apartheid.
Mm,
It's the dark history of medical experimentation on Black Americans from colonial times to the present. It's by Harriet Washington. And I held a book club on this book earlier this year. And it was eye opening for me because we hear about the Tuskegee experiment, we hear about Henrietta Lacks, but we don't hear about all the other
mm,
things that don't make it to mainstream. And I think it's important as researchers and just being in public health, anyways, especially if you're working with a particular community, to understand their history. What did they go through? What did they go through historically, and then how is that impacting them now? It's so important. So this book really helped, me look at the Black community in a different lens, because I'm part of the Black community and didn't know most of
mm.
this information in here. So it really made me look at how I approach the community. So yeah, I would recommend that book or any book that really sheds light on marginalized communities and what they had to endure and what they're still, what the impact is, was as a result of what they went through. So that would be
Yeah,
my recommendation.
yeah, great recommendation. Number five, where can people connect with you?
So I am on Instagram at Public Health Culture. I'm
Mhm.
on Facebook and Twitter. Public Health RC stands for Public Health Research Consulting. I'm also on LinkedIn for my name, Leonore Okwara. I do have a LinkedIn group. It's called Public Health Research Network. So that's a place where you can go and ask questions about research. I post a lot of different trainings and just helpful things like health communication and creating consent forms using plain language. So, yeah, that's where you can reach me. My podcast is Public Health Culture, and my website is publichealthresearchconsulting.com.
Okay, awesome. Well, thank you for sharing all of that, and I appreciate you taking time out your day to come on the show and share your insights and experience and stories.
Oh, yeah. Thank you so much. This is great.
Yeah, my pleasure. I'm just really happy that I got to have that conversation, and I just really love Leonora's focus on community-based research and just how excited she is about that topic and everything around it. And I'm just glad that I was able to get her on the show and share her story with you all. I know that she was someone that I connected with early on when I recently started like my platform and everything. But yeah, thank you so much for checking this episode out, everyone. Definitely subscribe, leave a review, like it, share it with a friend, tell your mom about it. I greatly appreciate it. Have a safe Thanksgiving, everyone, and take care. Public Health Millennial out.